is in UK for the last 17 years.
One of their main concerns is about passing OSCE.
Oh, okay.
Now, why am I here?
Yeah.
Then my sister had relocated to the UK. So she searched and she found that MWT Global Academy is really good in giving this training.
Okay.
And she came here. She passed in the first
That's
attempt.
really great.
You can imagine how happy my sister would have been when she cleared her exam. When I'm here in Kerala, I should come and visit this place.
Thank you. Hi. Welcome to MWT Global Academy. So, first let me introduce Ms. Liril Jacob Cherian. Liril Jacob Cherian, welcome to MWT Global.
Thank
now,
you.
Before going for that, I'd just like to introduce yourself. Okay. Liril Jacob Cherian is here at MWT Global family or global office. She had called us a few days before. She wanted to visit our OSCE lab. I think you might have already seen our OSCE lab in my previous video. Now, when she called us, we thought that it will be useful for my so many UK candidates who are who's willing to go to UK for their career. So I thought we will have a discussion. So, and you also hear the discussion what we have, and it is for you. The questions which I might be asking will be based on your interest. So, about Liril. Liril is currently working as advanced nurse practitioner in cardiac surgery in UK. She is in UK for the last 17 years. 17 years. It's a long years.
It is.
Yeah. And for your information, she is just from Kottayam,
Yes.
near to our place. She is from Kudallur, and she has done her schooling in Kottayam, and then she went for her nursing. So rather than me telling you, I would ask Liril to give your introduction, okay, more from your side. I just want to know how your journey was to UK and how it is till now. Okay, so I think you had a lot of experience before going to UK. So how it helped in UK. So I would like to have understand how it went.
So as Sir just said, I had done my schooling in Kottayam, and then I did my nursing, BSc nursing at Bangalore, MS Ramaya Institute. After that, well, at that time I initially thought, at that time everyone actually who were doing BSc nursing wanted to do the job of teaching.
Okay.
So I also decided that, okay, I'll go for teaching. That was my passion at that time. But one of our tutors, she told us, if you are going into teaching, you should know what you are teaching.
Okay.
You should have the practical knowledge.
Great.
So you should start your career as a registered nurse. Then only you will know what you are going to teach.
Great.
So I took her advice and worked as a nurse in Hyderabad for 2 years.
Oh, okay.
So that was the beginning of, in that 2000-2002 time, when everyone was kind of going to either UK or the US, like abroad in a general sense. So my brother was in Dubai at that time. So he said, why don't you come over to Dubai? We'll all be together. So I decided, okay, let me go to Dubai. And then I worked in Dubai for 2 years.
Okay.
Again, nurses there wanted to move abroad, mainly to US or UK, and they were studying for those exams and things like that. So I thought, okay, let me try UK. Well, those times, it was pretty much easier compared to how it is now. You just needed an IELTS score.
Okay. Just IELTS.
Just IELTS at that time, and you need to get registered with NMC, which was really easy. You just send your paperwork to NMC, they give you their PIN number, and then you get your IELTS score. And then there were lots of hospitals who were coming to Dubai for interviewing nurses. So it was pretty much an easy process compared to how it is now.
Okay.
And then, well, I was there in UK.
Okay.
So that was in 2005.
Okay.
And then I started my career. When you are there in UK for the first time, even at that time, because you are coming from overseas, there was a program that you had to complete, which was again easy. And once you complete that, you become the proper registered nurse.
Okay.
Up until then, you kind of work as an assistant, like healthcare assistant or something like that, and you get experience. You get to see the nurses there working. And then you become the proper registered nurse once you had completed that overseas nurses program. It was called overseas nurses program at that time with the university. And then you become a band 5 registered nurse.
Okay.
So I worked as band 5 registered nurse for a few years. Then I moved to a band 6 senior staff nurse,
Okay.
which had more of managerial role as well.
Okay. That was how many years?
Well,
After how many years you worked as a registered nurse and then you went for the managerial post?
Well, honestly, I lost count of that. I can't remember exactly how much, but I would say it would all depend upon how enthusiastic you are.
Oh, great. Okay.
And then once you are there, you get to do lots of modules with the university there in nursing. So how it works in UK is if you want to go for, well, I completed my master's while I was there, master's in advanced practice. So how it works there in the UK is you can do specific modules which is related to where you are working. So when I was working in intensive care, I did courses related to like critical care modules or cardiac care modules because I was in cardiac ICU. And then for each module, well, it might be a 3 months module, 6 months module, and based on whatever, like you get points, you get credits, 20 credits. And then you accumulate those credits, and once you get 180 credits, which is what's needed to complete your master's, you get master's. But again, there are 3 specific modules. You can do whichever one you want related to your area of practice, but these 3 are must modules, which is research, methods and methodology, leadership and innovation in practice, and then the final one is either a dissertation module or a evidence-based practice module. So once you get, and you need to do that in master's level as well. There are different levels when you do each module. You can do it in a lower level or advanced level, which is master's.
Great. Okay. Thank you, Liril.
Oh, well, I didn't complete this. So then I worked as a band 6 senior nurse. And then I moved to become an advanced nurse practitioner, which is again a higher grade. And then it is more of kind of a junior doctor. And I also did a prescribing module where I can now prescribe medicines for patients.
Okay. So that is what this practitioner means.
Yes. So it's a specialist nursing.
Okay, great.
So you choose a particular field. So that's one of the things that once you are there as a nurse that you can do, for your career options. You can become a specialist nurse, advanced nurse practitioner. Like there are different fields. There is, for example, heart failure specialist nurse. There is arrhythmia nurse or ACS, acute cardiac care. Yeah, different areas. Even diabetes specialist nurses or stoma care nurses. So they are specialist practices. There are in lot. I say more about cardiac because I work in cardiac, but in almost all the fields, ENT, on cancer, there are almost in all the specialities, there are specialist nurses who are working kind of in a specialist way. Their job may not be this day-to-day ward care kind of nursing, but a bit more of specialists. They might see patients in clinics, prescribe them medications, prescribe them treatment, follow them up.
Okay.
Yeah.
So then, are you considered as will you get a post like doctor, or when you say you're a medical practitioner?
Well, when you go higher, there is nurse consultant.
Okay,
that's
great.
even higher post.
Okay.
I'm not a consultant yet.
Okay. So you are planning for that?
Well,
Yeah.
if you wanted to, you can. But at present, what I do is we do the ward rounds. We see patients, in cardiac surgery, we see patients who are going for cardiac surgery, pre or post-op cardiac patients. We plan their day-to-day, like what's going to happen today. If it's day 3, what should we be doing today?
Okay.
We look at their blood results, plan accordingly. We look at their medications, vital signs. We add or like maybe reduce, titrate medications. We order investigations like X-ray, echo, whatever is needed to be done. We do
prepare for the surgery.
We prepare for this admission clerking. Even when patients are discharged, we do the discharge letter to the GP, like the doctor they are looking. Kind of.
Okay, great. It's really, it was so a long journey. I think I felt I should have done this, even though I am not from this nursing background. But of course, this will really be interesting to many nurses who want to pursue their career.
Sure. One more thing I would like to say is, like, I had also done audits and research in my career.
Okay.
And again, with those audits that I had done, I'm happy and proud to say that I had made changes in practice.
Oh, that's great. So,
policies.
You made policies.
Yes.
So that is also an extra area.
Of course, yeah. And I am a published author as well.
Wow,
My
great.
articles had appeared in leading nursing nursing journals, including British Journal of Nursing.
Wow, very good, very good. It's really nice to know.
Thank you. And I'm also an occasional associate lecturer at the University of the West of
Wow,
England,
great.
just on cardiac related modules.
But still, that's an achievement.
Sure,
That's a real achievement.
So why I'm saying this is, there are lots of interesting ways you can progress when you come to the UK in career.
That's the reason I wanted to ask you all these questions. Okay, you said, now let me go back a little.
Sure.
So you said that when you went to UK, you worked as a assistant care worker till you finished your exam or this program.
Yes.
Overseas nursing program.
Yes.
Okay. Till then you worked as a carer. Was it a carer or?
Well, you can't say exactly care, but the difference is that if you are going to give a medicine to a patient, you should be an RN. You should be a proper RN.
Okay.
Up until then, you can't give a medicine. You know everything. You had worked previously in India. You know what the medications are. But there, up until you get your PIN number with the NMC, you can't give medicine.
Yeah.
So what do? You can just only do the other little
small
exactly.
Okay. Because why I asked is because I am not from a nursing background, but I have been associating with nurse for the last 12 years. Okay.
Yeah.
So I see a lot of questions. I see many nurses who come to me and then they, when we say that, when you reach UK, you'll be initially working as a carer. Then the first thing they go, I am already an RN over here. Why should I go and do this carer job initially?
Yeah.
So I can always tell my team members or candidates that why you should be in a transition period before you get a RN in UK.
I would say it's actually an opportunity for you to, because giving a medicine is in itself a responsibility. You can't make a mistake in it. It's a huge so when you are working as an assistant, like healthcare assistant, when you're waiting to become an RN, it's an opportunity for you to learn as well. You can look at, you will be working with other registered nurse, so you can get to see their practice, how they do things in UK. And of course, there will be a cultural difference when you move from India to UK. So there is, this will be a chance. This time will give you some chance to learn how things work in UK. Yeah. So I will say, don't be afraid of this transition period.
Perfect. Okay. Now, Liril, my big question. It's really wonderful that you are over here.
Thank you.
Okay. We really appreciate your visit to MWT Global. Okay. Now, I just had a curiosity. How you came to know about MWT Global and the reason behind you, because I know you came here for a short visit to India to visit your family and all, but you took time to call us and get a schedule for us to want to visit our OSCE lab. How you came to know about MWT Global and what is the reason behind your visit?
Sure. I think I'll tell that in two sections. First of all, let me tell about OSCE. And one of their main concerns is about passing OSCE.
Oh, okay.
And it's a genuine concern too, because there are many reasons behind that stress that they have. A, you need to pass the OSCE to get your PIN number with the NMC.
Okay.
Up until you get this PIN number, you can't practice as a registered Band 5 RN. And then, being an RN and working towards being an RN, there is a huge difference between the two. Not only in perspective of career, but also financially.
Okay.
And all the nurses who are there, you don't want to waste your time to become an RN. You want to become an RN as soon as possible. Because, they might have other things in their mind to bring their family over or whatever. So they want to become an RN. Now, when you go back to OSCE, there are various stations in an OSCE. And you need to pass all the stations to get the pass. If you fail even one, that's a fail.
Even one.
But then, when you are going to reappear for the second time, you only need to appear for the station that you lost.
Okay.
However, when you are going to appear for the second time, the cost towards appearing this OSCE, the second OSCE, you should pay from your own pocket.
Not the employer will not.
The employer will only pay for the first attempt.
Okay.
The second attempt you'll have to pay yourself. And again, you don't know when you are going to get a date for the next OSCE. It might be weeks maybe, but it can be even months. So that's going to be another wait.
Yeah.
So all the nurses want to pass the OSCE as soon as possible, and it's it's not an easy exam as well. It's tough. You can fail for even a minute detail.
Okay, great.
So they are stressed actually.
Yeah.
So they are always talking about this. Oh my God, OSCE, am I going to pass? And the failure rate is really high as well, because I have seen maybe 8 nurses will be going for this OSCE one day. If they are lucky, 3 of them might pass. So 5 can fail. So that's how it is. That's really tough. And then they'll have to reappear. So they are really, really stressed about it.
Okay.
Now, why am I here?
Yeah.
I have personally witnessed the stress recently when my sister had relocated to the UK.
Okay.
Yeah, so my sister got an opportunity in the UK and she relocated recently, and she was really stressed about, as everyone else, about this OSCE. And again, when you are coming to the UK, you do not know when you are going to get the date. It can be just as quickly as within weeks, or it might take time. In case that you are going to get a date really soon, my sister was worried she may not get enough time to practice there. So she thought, why not I get some training before I leave. So she searched and she found that MWT Global Academy is really good in giving this training, and she came here.
Okay.
So she got some prior experience in this OSCE topics and training before she come to UK.
Okay,
and guess what?
Yes. Did she clear?
She passed in the first
That's
attempt.
really great. So you see, okay.
Yeah.
So you came to know from your sister.
Yes.
So I think, how was the training go? So did she get the similar effect, and was it beneficial for her?
My sister told me that the training that was given here at MWT Global Academy is of the same standard and quality as that was given there in the UK.
Oh, thanks. Thank you.
Yeah.
It is really good to
Yeah,
know.
and again, she told me that the training was exceptionally brilliant. There were people who had huge depth of knowledge in their subject, and professionals who had worked previously in European countries.
Yes.
That makes a huge difference, she said.
Yeah.
Again, another thing she mentioned was she was kind of a bit scared before she left India about how the accent of people there would be. Will she be able to follow that or what? Again, she said, well, she had some struggle following the accent because it's the first time she was there. But since she had training here, she was familiar with the topics and the training, and then that made her follow them really easily. And then, you can imagine how happy my sister would have been when she cleared her exam. And she was singing praises of this place so much so that I decided when I'm here in Kerala, I should come and visit this place.
Thank you.
Thank you.
Yeah. Yeah, it was really nice, and it's really it's motivating for us that our OSCE lab is is at par with UK test, and we have our educators are really doing a good job.
Yes, you are. You should be proud of yourself. See, I have seen your OSCE lab here, and I would say I'm really pleasantly surprised to see how good, how you had set that up. When you see the equipments and when you see the supplies here, you would actually think that you're in a European hospital setting.
Thank you.
It's really well done.
Thank you. And now, coming to the next stage, thank you for giving us an overview of all how the OSCE test is. And you said that even one station, if you fail, it will really make problem for a nurse, and how stressful they are. So we are here to make them stress-free by giving them a training over here. Now, coming to when I discuss with many people, most of them say the niceties of UK.
Okay.
But I want to be a little different. For my candidates or my nurses who want to pursue their career, can you experience? What I understand from experience is the failures which we have. Okay.
Yeah.
Now, when I say failures, of course, these are the stepping stones. We correct it, and then we become a success.
Yeah.
Of course, I know that when you go to UK, there are certain things which we are not supposed to do, and which we are supposed to not to do and to do.
Yeah.
Now, I want to know what are the things which we should not do. Okay, when you are in UK as a fresh nurse.
Yeah.
Okay.
Yeah.
Whether because currently everybody says the moment they finish their classes they want to go to UK. We are fine with it.
Yeah.
But what are the difficulties of a fresh nurse faces when they reach UK?
Well, I would say, as a really fresh nurse, I'm thinking about myself when I graduated, you really do not actually know the practical aspect of nursing. You will know only that when you are actually a nurse working on floor.
Okay.
And then it makes a difference when you go abroad, what they see, what they look at you, how they look at you is that you have experience.
Mm-hmm.
And you get that experience only after you work. How much ever you study theory or during your nursing course, that may not be sufficient to work as a proper RN in the UK. So I would say get at least a couple of years of experience before you plan to relocate to the UK.
Okay.
Again, when you come to the UK, that will give you an idea of how things work differently in here and there.
Okay.
So there they follow policies, guidelines in whatever they do. Maybe it's just putting an IV cannula, but they have a policy.
Mm-hmm.
And then, they go according to the policy. Here, I don't know, I haven't worked recently, it's been many years, but when I worked, you just go and put a cannula.
Yeah.
Maybe it might have changed, but what I want to say is they follow everything according to a policy and protocol guidelines. Okay. Again, there are lots of differences, like cultural differences when you say things there. One of the main things I would stress to people, whoever is going to the UK, is using please and thank you.
Oh, in UK?
In UK.
Okay.
Well, they might ask you, would you like a cup of tea? And then you would think, if you say nicely, oh yes, I would like a cup of tea, but that's not the way you have to say. You have to say, oh yes, please.
Okay, that please word should be there.
That please word should be, otherwise it's considered rude.
Okay.
And then if someone is giving you a cup of tea, you'd say, oh thank you. But thank you and please, even when a patient receives his medicine, when you are giving a medicine to the patient, that's, the patient has the right to get his medicines, but the patient would say, thank you for giving me the medicine. So that's their culture. So there are lots of things like that we wouldn't expect, like saying please and thank you with each sentence.
Yeah.
But that's how you should be. But once you are there, you will know all this, but it's nice to get that knowledge, isn't it?
Before that, yeah.
Yeah, so there are lots of things like that.
So these small things really make life better.
Of course.
Isn't it?
Of course.
I really understand that. And so there are certain things which we should understand, and the nurses should understand before going. So what I suggest is, of course, a fresher can go, but they should have a bit of polishing or understand how it is before they reach UK. Now, I think you also suggest the same thing.
Yes.
Now, my next question would be, or what I would like to understand is, as you said, you are currently a advanced nurse practitioner. Okay, this practitioner word might be new for many people, or it might be a common term nowadays. But I understand that it is there are stages you have gone through to become a practitioner, advanced nurse practitioner.
Yeah.
And especially in particular specialization, cardiac.
Yeah.
And as you said before, there are different categories where you can become an advanced nurse practitioner in different. So I just want to know, from here they finish their nursing, BSc nursing or DNM or what are the different options or outcomes they have?
Yes.
Okay.
Yeah.
In UK or anywhere else in the world.
Yes.
For a nurse to become, it's not just nurse.
Yeah.
It's just not RN. That's I know.
No. So there are various ways you can progress in your career depending upon how your choices, your interest. You can go in the managerial line, become a senior staff nurse, and then become a sister. That's what they say for the charge nurse. It's band 7 post. Or then you can become a matron, or you can become a head of nursing, deputy head of nursing, even a nursing director, wherever you want to. That's the managerial section. If you are more interested in clinical section and want to move upwards, you can become a specialist nurse practitioner, advanced nurse practitioner, or you can even become a nurse consultant. You can manage clinics. You can, there are nurse consultants who work in like A&E, accident and emergency. That area, and they consult patients. So there are various ways you can move upwards in the clinical area. If you are interested in doing research, there are fields, research. You can become a research nurse and move in that area. in case you're interested in teaching, you can pursue that as well.
Okay.
There are in the hospital setting itself, there are teaching professionals who are there to support with the nurses who are already working to upgrade their level of knowledge. But instead, if you want to work in a university as a lecturer, or and then again you can grow up there as well. But there are lots of opportunities, and you can work as a nurse in general GP surgery as well. I don't know whether you are familiar with that term, but in the UK, we don't have these private hospitals here where if you get a fever you can just run into whichever hospital you have. But there we have, in each area, we call that GP surgery, general practitioner surgery, or family doctor as they say in US. So you go there and then get your treatment from there. But if it's something that needs specialist attention or a hospital treatment, then the GP would refer that patient to the hospital. That's how you go to the hospital. Otherwise, unless it's an emergency case, you will not go to see a cardiologist in a hospital just like that, unless your GP had referred to.
Even if you want to.
Even if you want to.
Okay.
Yeah. Otherwise, the GP, the doctor should be your friend.
Okay. Okay. Fine. Okay.
Well, what I was going to say is, in the GP surgery, there are also nurses, specialist nurses, who see patients, do their own clinics. So there are various ways you can progress.
So what I understand, and I think it's beneficial for most of our viewers, that it's just not a nurse who is going to UK or anywhere. They have lot of different opportunities in their career.
Yes.
And yes, of course, it might take years, but that years really counts because you have experience in each area.
Yeah.
Okay.
And you need to study there as well. As I said, you can do modules in university. If you want to become a specialist in asthma, for example, you can do modules in university related to asthma care.
Okay.
And then if you're lucky, there comes a post for asthma specialist nurse and you apply. And because you have this background of training in that area, it might be easy for you to. So you do modules that are of your interest.
Yeah.
And then,
So it's a real Pandora box you have for a nurse, isn't it? Because as a layman, what I thought was a nurse is always a nurse till the end.
No, actually there is, in the UK, I would say maybe 50% of the nurses would be on the floor. There are other maybe 50% working in like managerial levels or research, education, teaching specialists. There's a lot of opportunities for you to grow into. But of course, you should have that energy and enthusiasm within you.
And work hard.
Also, and work hard.
And determination also should be there.
Yes.
Now, coming to all this, is there any remuneration difference? That I think most of the viewers would like to understand. If I study more, will my remuneration also, will it change?
Well, when your band goes up, your payment, the pay scale goes up.
It's universal, it's for everyone.
It is for NHS. The payment is based on which band you are working. So when you are initially as a registered nurse, it's band 5. I don't know what the current salary scale would be, but maybe it's somewhere around 28,000 to 31,000 pounds per year.
That's true.
Yeah, but when you become band 6, that scale goes up.
Okay.
When you are band 7, that goes up.
Okay.
Band 9 is the highest.
Right. So I think most of the nurses would look for the band 9.
Yeah, nurse consultant is band 9.
Okay, so I think you are also aiming for that. Okay. Thank you, Liril. It was really nice, very good information what you have shared. Now, for my nurses who is planning to go to UK, most of them come over here and they ask me, do you have an opening in one particular area and some different areas? They give me names of certain cities. Is there any difference whether they go to Cheshire or Northern Hampshire or anywhere? Like you work in Bristol,
yes, yeah.
And then in London.
Yeah.
So what is the difference, and why everybody is asking in such a manner, which I would like? Can you enlighten us?
Sure. Well, what I think is London area is a bit more costly to live in.
Okay.
The accommodation obviously is really costly there. But then I think there they pay for that cost as well. There will be a slight increase in salary for nurses who are in London to compensate for those cost of living. Then I think southwest of England is kind of, the lower bottom is considered as a better place compared to the north, which is higher. Maybe because it's a bit more colder when you go up there. But generally also people like to come to the
southern,
southwest and
okay.
southeast more, or maybe it could be just because they have some family or friends in a particular area and they
okay.
want to be with them. But if you are coming to, like, I would say, don't wait for your choice hospital to join there. I would say just, when you get the opportunity, grab that opportunity and come over there. After a couple of years you can move, can't you?
Yeah, that would be the best structure.
Yeah.
Okay, thank you, Liril, and thank you. It was lovely talking to you because I felt as if I am in UK.
I feel so proud and privileged because you have given me this opportunity to talk to you and share my thoughts. Yes.
Yeah. So another thing is, and it will be useful, this discussion what we had. So whatever I asked you and whatever you were given me, the information, I think it will benefit a lot of nurses who want to pursue their career in UK or abroad or wherever they want to go. And of course, they can come here, they can have a look at the OSCE lab, they can taste, they can practice their OSCE before they go to UK. And so it will be beneficial for everyone.
Yeah, I would highly recommend this place to nurses who are planning to relocate to the UK. I have come seen this myself. I have personal experience of my sister coming and having training here. And I would definitely say that the training that you get here would certainly boost your knowledge, skills and attitude.
Thank you, Liril.
Thank you.
Thank you once again from MWT Global.
I would very happily recommend this place to nurses who are planning to relocate to the UK. The topics and the training that they give here is of exactly the same quality as that's given in the UK. And the educators here, they are highly trained professionals. They have the depth of knowledge and they know what they are doing. And the training that you get from here, I'm sure, will boost your confidence and will also make you more knowledgeable, and your skills and attitude will be finer as well.
Thank you all for keeping glued to this video. I hope the nurses who are planning to go to UK would have benefited from the discussion I had with Mr. Liril Jacob Cherian, and it was really nice of Liril coming over here and sharing her experiences and sharing her the information about UK, what they expect from each nurse, and what you people can become in UK. It's just not the nurse. There are a lot more. You can become a GP, a level 9, band 9 in UK. So I give you all the best from my heart to everyone to become a level 9 nurses in UK, and of course keep the name of India wherever you go. Thank you.